Hi, I'm Dr. Suzanne Craig from the Perry Centre, and today I've got with me Dr. Alex Perry, who will be answering a few frequently asked questions. Why should I start treatment with you so much earlier than my transfer, when most of the information I read is just before or just after transfer?
That's a great question, Susie. I think, a couple of years ago a big research study came out about acupuncture and IVF, and it was a meta-analysis of a whole bunch of studies that had been done. And the bulk of those studies really focused on acupuncture treatment immediately prior and immediately post the embryo transfer itself.
Yeah.
And I think that's definitely a valid way of looking at it. And it was in terms of running a randomised controlled trial, that's a good way of studying the effect of acupuncture because it keeps everything nice and tight.
Yeah.
In fact, later this year we're going to be involved in an acupuncture trial with IVF, which is really exciting.
It is.
And good for the patients, because the more research, the better. The better our understanding, the better our treatments are going to be. But to answer the question, look, we really like to start a patient early on in the cycle. Now, ideally, we like to have 3 months prior to an IVF attempt, and there are a few reasons for that. The first one is that it gives us an opportunity to create a diagnosis and a relationship with the patient, so we know what's happening in their cycle. Okay? So for example, if a patient comes in and they've got some period-related issues, I'm thinking about things like endometriosis, clotting, period pain, heavy periods or very light periods or no period at all, that embryo is going to arrive in that environment. Yeah. Now, if I think about fertility and what affects fertility, it's got a lot to do with the environment. If the environment is brown, clotted, painful, or something else that is not perhaps ideal, then it's going to make it harder, from our perspective anyway, for that embryo to take its place in your uterus.
Yeah, sure.
Okay. So I think that that 3 months generally gives us enough time to make significant change, to reduce period pain, to get better blood flow, to reduce clotting, and make that whole environment a lot happier. So when that embryo, which is that's the most critical part, right? The embryo is being created by you and your partner, or by donor sperm, or whatever the case is. That embryo is absolutely critical. So we want to make sure we give it the absolute best chance of hanging around in your uterus. So we're going to spend a little bit of time preparing you for that. The other side, Susie, and you would have seen this a lot in patients as well, is the emotional aspect, right?
100%.
If you turn up the morning of embryo transfer and you've had no preparation emotionally, how are you feeling? I can tell you're going to be feeling pretty stressed. It's all pretty hardcore. So, if we can have some preparation time, we can work on getting your body prepped, but just as importantly, we can work on getting your mind prepped. And that's really, really important.
Excellent. Great. Thanks.
No worries.